I'm afraid we are starting to lose the fight against corruption. When I reflect on this, I ask myself, what is it that we can do to strengthen the institution of EACC? Failing which, we disband it completely so that we look for a different way of combating corruption. How can it be, Mheshimiwa Mugatana, that parliamentarians are informed by the Auditor General, they call auditees, they get evidence, they confirm the concerns of the Auditor General, and when you forward to EACC, nothing happens? It is because they are corrupt. The EACC people are selling parliamentary reports to the very people they are supposed to prosecute. Mr. Speaker, Parliament must help Kenyans by addressing EACC. What's more, we must also question, Mr. Speaker, the office of the President. Why is it that we have members of the cabinet, in the current cabinet, who have got active cases forwarded by EACC for prosecution, Mr. Speaker? Mr. Speaker, you are all aware about the outcry about SHA. Mr. Speaker, it is because of corruption. Mr. Speaker, for the last 4 days, the so-called pre-authorization that is supposed to be done before a patient accesses services of SHA, there is a countrywide collapse of the network and or downtimes of that network, Mr. Speaker. Mr. Speaker, it is because there is a deliberate effort by corrupt people in the hospitals to ensure that the services of SHA are not accessed. Instead, members of the public who have been contributing to SHA are asked to pay in cash. Mr. Speaker, you are aware that as of yesterday, 204 schools have closed down because of the unrest. Mr. Speaker, it is because of corruption. Mr. Speaker, why is capitation money either delayed or not sent to schools, forcing the headmasters not to keep?
Thank you, Senator. Give him 1 minute.
Thank you, Mr. Speaker. Mr. Speaker, the issue of the 204 schools, we are all quiet. The ministry is quiet. The appointing authority of the minister is quiet. Parliament is quiet. And our children are dying in schools. It is because of corruption. In some of the cases, Mr. Speaker, corruption is responsible for the active cases against criminal students who have been arraigned before court to be dragged on and on for years until they eventually released and members of the public are not aware. We must fight corruption. I thank you, Mr. Speaker.
Thank you, Senator. Senator Dulo.
Thank you, Mr. Speaker. Thank you, Mr. Speaker. I wish to support two statements. One by Senator Roba on the pending bills. Mr. Speaker, I wish to congratulate this House having rejected the passing of a pending bill for Meru County. It's because of personal interest. That's why the House was forced actually to pay the pending bills. Mr. Speaker, we are not doing very well as far as pending bills are concerned. Many of our businessmen, they are really languishing in poverty. Counties are paying fake pending bills. And I know this budget we struggled to pass yesterday. It's going to go into campaign. And the institution that are mandated to oversight the usage and utilization and accountability of those budgets, they are in slumberland or they are in bed with those corrupt county governments. Mr. Speaker, I wish this House, instead of us always lamenting, especially Finance Committee, you need to take serious measures as far as pending bills are concerned, because they keep on accumulating. You can imagine a county having pending bills for legal services, over 100 million. What are they doing, you know? There are pending bills that are not even going down from 1.5 or 1.2 billion, like my own county. The only people who are paid pending bills, Mr. Speaker, are those who are politically correct. I think as a country, we stop lamenting and we take serious action. Finally, on the NPRs, we need actually to see how we can formally engage NPRs, because they complement the work of police and also APs. Whenever we have challenges, Mr. Speaker, those people are the ones who are in forefront. Secondly, the manner in which NPRs are actually given out in those counties, there is so much corruption that is going on. Those who are politically correct are the ones who are given NPRs. The rest are left out. Some of the people, they are even given NPR firearms. They sat in town and chew mara instead of being in the bush to help the pastoral communities or defend the communities where they are supposed to be assisted. So certain things needs to be done. Yes, there is a lot that the government is doing as far as NPR in those affected areas is happening, but it should be done in a transparent manner. I thank you, Mr. Speaker.
Thank you, Senator Murango.
Asante sana Mr. Speaker. Ningetaka kuchangia taarifa ambayo iliombwa na Senator wa Kitui, Senator Wambua. Mr. Speaker, matatizo ya afya katika gatuzi zetu zimekuwa nyingi sana na imekuwa ni changamoto. Sana sana kwa upande wa wale ambao wanaangalia kuhakikisha kwamba kila kitu kinafanyika kwa njia iliyo sawa. Mr. Speaker, msongamano katika hospitali zetu ni jambo la dharura. Kwa sababu Mr. Speaker, wakati watu wamekuwa wengi, wengine wanalala kitanda kimoja, na wale wanalala katika kitanda kile kimoja ni wagonjwa. Kwa hivyo wanaweza ambukizana magonjwa, na ya pili ni kwamba mgonjwa anafaa kupata mahali dhabiti ambapo anafaa aweze kupona. Mr. Speaker, katika Kirinyaga mahali imetoka Mr. Speaker, tumekuwa na changamoto kubwa sana kwa sababu ya mandawa, zile picha ambazo zinapigwa wagonjwa. Juzi kulikuwa na ile lift ambayo ilikuwa imeharibika takriban ya miezi mitatu. Tumekuwa na changamoto ya wahudumu afya ambao wengine hawajalipwa mishahara na marupurupu yao kwa miezi mitatu na wengine miezi 4. Mr. Speaker, wale wahudumu ambao wanaosha wagonjwa, wale ambao wanahakikisha kwamba hospitali zetu ziko safi, wale wanaangalia maradhi na kuhakikisha kwamba wagonjwa wamekula, wale ambao wanashikilia wagonjwa wakati wanatoka kwenda kuota njua, kwa wale ambao hawezi tembea, Mr. Speaker, wakati hawajalipwa takriban miezi 3, inakuwa ni changamoto kubwa sana. Lakini Mr. Speaker, wakati tunapoongea kama maseneta kuhusu matatizo inayowakubwa wafanyikazi wa hospitali zetu kama pale Kirinyaga, unapata ya kwamba wale wengi ambao wameajiliwa wanakuja wanauziwa uoga na kuambiwa atakayeongea atafutwa kazi. Wanaendelea kuteseka. Tunasahau kwamba wale ni watoto wa watu. Wale wafanyikazi wana nyumba wanalipa. Wako na chakula ambacho wanafaa kununua. Wako na watoto wanaoendea shule ambao wanafaa kukimu anda zao. Lakini Mr. Speaker, unapata gavana anaita mkutano moja watu wawili watatu, anawapiga pambaja na wanakubaliana kwamba kila kitu iko safi. Wananchi wanaendelea kuteseka, na wale wahudumu wa afya ambao walipo mishahara wanaendelea kuteseka. Mr. Speaker, ndio leo nasimama kwa sababu tunakuja kupitisha tena fedha ambazo zinaenda kwa magavana. Waweze kuchukua jukumu, waache kuzimbia panya shimo kwa mikate wakitarajia watakufa. Mr. Speaker, waweze kuchukua majukumu yao, na wajue ya kwamba hata wakiendelea kutukashifu sisi tunaoongea, haitaokoa maisha ya wale ambao tuko nao, Mr. Speaker. Kwa sababu Mr. Speaker, Waswahili wanasema ukikuja ukashifu mwenye akili hakuwezi kuondoa ujinga wao. Sasa tunataka ujinga huo uondolewe katika nchi zetu, watu wetu waweze kupata matibabu.
Thank you, Senator Wakoli.
Thank you, Honorable Speaker. for this opportunity to ventilate on statements raised by honorable members. Honorable Speaker, I want to begin with the statement from Senator Omtata with regard to cricket, Honorable Speaker. When we were growing up, Honorable Speaker, Kenya was leading in Africa and globally. And it's quite heartening that we have degenerated to a point where we are discussing the sports in Parliament, yet we have a Ministry of Sports in this country. But in the same wavelength, Honorable Speaker, knowing very well, and Honorable Speaker, can you rein in on Senator Maanzo? Honorable Speaker, Honorable Speaker, you are not also listening. Honorable Speaker, I request that you listen to us than our good friend who is whispering loudly, Honorable Speaker. I am saying that sports is devolved. And when you look at counties in this country, Honorable Speaker, they are doing less or nothing with regard to sports in this country. The president is building stadiums across the country. But if you ask the county government how much they are putting into sports growth and searching in this country, it is zero. And therefore, time is up, Honorable Speaker, that this House push the Council of Governors and Governors to task. I want now to finalize on this issue of the health sector, Honorable Speaker. It is now emerging, Honorable Speaker, that county governments and the executives in the county governments are using this department to make money. Some of them are keen to get tenders for cleaning services and detergents. Some of them are keen to get tenders for non-farms, Honorable Speaker. Some of them are keen to supply food. They call it food ratios in the facilities, Honorable Speaker. And at the expense of buying drugs that the people need to use, Honorable Speaker. It is also emerging that the executives in charge of health will send administrators and accountants who are either tribally aligned, politically aligned, or commercially aligned, so that they smoothen the operations of leasing and looting monies from these facilities, Honorable Speaker. As we are speaking today, if ESCC was to up its game, the share resources as they land in these health facilities, they have already got instructions on which percentage of the monies should be channeled to specific people to benefit them at the expense of the patients. And
Thank you, Senator. Give him 1 minute. Conclude.
Thank you, Honorable Speaker, for being gracious against these marauding senators behind me, Honorable Speaker.
I want to communicate to the great people of Bungoma. What I've clearly said here is happening on the ground. And I will work with you and work with you and ensure the cartels that are fleecing the resources in the health sector are brought to book. I will not let you down. I will run with you and I will speak for you. Thank you, Honorable Speaker.
Senator Cheburet.
Okay, thank you, Mr. Speaker, for the opportunity you have given me to also contribute and make a positive comment about the statement that has been read by Honorable Senator Lelengwe for Samburu County. Mr. Speaker, before that, I want to appreciate the distinguished senator from Samburu for submitting this issue before the floor of the House. Mr. Speaker, the issue of national police reservists is actually a sensitive matter, and it needs proper attendance, and as House and leadership, the issue of national police reservists needs proper attendance. These police officer reservists, Mr. Speaker, are going through a lot. They are not paid by the government. Their monthly salary is not defined, and they are failing to pay their school fees for their children. They are unable to settle their medical bills due to their share is not working. So, Mr. Speaker, Senator Lelengwe, I've only mentioned about Samburu.
And Mr. Speaker, I want to tell you, several counties, including Baringo, where I come from, Elgeyo Marakwet, Samburu, Turkana, West Pokot, and several counties, Mr. Speaker, are being, these National Police Service are the people behind the successful peace restoration in our counties. And therefore, we want the Ministry of Interior and Coordination to take serious note on the matter of National Police Reservists and to ensure that their payments are defined. They need to be treated with a dignified way, just like any other civil servant in our country. So, Mr. Speaker, I want to plead with the Ministry of Interior and Coordination to consider the National Police Reservists just like any other civil servant in our country, and their salary needs to be defined because it is very dangerous to mishandle the people who are behind our security. So, Mr. Speaker, I want to congratulate the Senator for Samburu for bringing this matter before the floor of the House, and I want the Committee on Security to address this matter and ensure that the dignity is restored within National Police Service. Thank you, Mr. Speaker.
Thank you, Senator. Senator Sigei.
Thank you, Mr. Speaker. I want to comment on two statements, one by Senator Okia Omtata on the effectiveness of the Ethics and Anti-Corruption Commission in the fight against corruption. Every day, every morning in this House, Mr. Speaker, we talk matters devolution, we talk matters service delivery to the people, and the statement requiring the Ethics and Anti-Corruption Commission, Mr. Speaker, to give us a status report and also the effectiveness in terms of investigations and action against audit concerns and queries, both from the Office of the Auditor General as well as those from the committees of this House, has been put to question. Mr. Speaker, the committee that has already been committed this particular statement, I would expect, will be in a position to establish the extent of all those reported matters of counties across the divide where both the Auditor General as well as the various committees of this House have raised concerns, and to give us a status report of what they have done. I say so, Mr. Speaker, because as Justice and Legal Affairs Committee, we are aware that not once, not twice have we summoned the CEO of Ethics and Anti-Corruption Commission to appear before the committee to give us status report on inquiries that have been made by almost all the county representatives in this House on investigations on the status of matters which have either been litigated upon or have been filed, and also in action that either they have been taken or are planning to take with regards to corruption. Mr. Speaker, I'm aware that the Auditor General in the financial year 2022-23, 2023-24, and 2024-25 had raised a number of matters in the county of Bomet where the Office of the Ethics and Anti-Corruption Commission were undertaking various investigations. We are yet to receive the status of those investigations, and that definitely, Mr. Speaker, calls upon their effectiveness. I call upon the CEO of Ethics and Anti-Corruption Commission, Mr. Abdi, to make sure that he turns up whenever this House or this committee, rather, the various committees, rather, calls upon him to give us the status reports of those investigations. Secondly, Mr. Speaker, about expiry of drugs in our various dispensaries, hospitals, or even at KEMSA. Mr. Speaker, it's quite unfortunate because this is one of those things that we, in the course of our oversight roles, where the Committee on Health have done visits to a number of our dispensaries or institutions within the counties.
Thank you, Senator. Senator Veronica.
Thank you, Honorable Speaker, for the opportunity to comment on the statement by Senator Hamida on GBV, and I'll also comment on the statement on the health status of Kitui General Hospital, together with the hospitals in different counties. Honorable Speaker, and I'm also grateful that after a long wait, you've given me the chance. The system locked me out, and I was pushed to the last person in the queue. Honorable Speaker, it is very sad to note that in the Republic of Kenya right now, we have had increasing numbers of gender-based violence cases, which are now rampant across counties, with some of the urban counties being affected very negatively, Honorable Speaker. Just a few minutes ago, I have seen a case in Nyeri County where a woman's body has been dismembered, put in a sack, and positioned near a certain village, Honorable Speaker, at a place where it is clear that whoever dismembered that lady intended to take some of the organs from her body. Honorable Speaker, it is very, very sad that in this day and time, when we have technology that could assist in curbing crime, we have had more women suffering gender-based violence cases, and we have had cases of femicide which continue to remain unresolved. Honorable Speaker, we must take an approach now, and as the committee looks into these issues and looks into this statement, Honorable Speaker, the whole community and the whole society now must take an approach that helps women to be emancipated from this kind of violence that we are seeing becoming rampant. Honorable Speaker, it is important that we criminalize any form of violence against any gender, and specifically against women. Honorable Speaker, we have seen most of the people who are victims of this gender-based violence, some of the aggressors are coming from a relationship that they have with the victim, Honorable Speaker. So you find within our homes, there is very high level of gender-based violence. Women are not only being beaten, but after relationships are broken, Honorable Speaker, women are suffering the blunt end of broken relationships, because most of these people who are aggressing against the women and against girls are either partners or friends or spouses or people within a setup where they have a relationship with the woman who is aggrieved. It is very sad, Honorable Speaker, and we are looking up to the CS security to come up with very serious measures.
Thank you, Senator Chute. We are out of time for the statements. Give her half a minute to conclude.
Okay, thank you, Honorable Speaker. We are calling upon the CS for security, interior, to ensure that these cases are resolved, Honorable Speaker. I have looked at one of those cases where a woman was murdered in Kilimani, and the case was in Nakuru. And Honorable Speaker, these cases remain unresolved. We are looking up to the CS for security to ensure that we have speedy conclusion of all these investigations and the culprits can be brought to book. Thank you, Honorable Speaker.
Thank you, Senator Chute.
Thank you very much, Honorable Speaker. I'll be very brief, Honorable Speaker. Allow me to contribute to the statement by Senator Enoch Wambua. This statement is heavy and weighty, Honorable Speaker. Honorable Speaker, about 2-3 weeks ago, community health promoters from Marsabit sent me a letter. The letter says they have not been paid for the last 7 months. Honorable Speaker, as you are aware, the government is paying $2,500 per person, and the county government is supposed to also similarly pay another $2,500. The national government has paid the dues, but up to today, for the last 7 months, the community health promoters have not been paid in Marsabit. I know, and you know, and this House knows what these people are going through. Even Kenyans know what they're going through. The kind of work they're doing at the hospitals, the problems they go through. Imagine somebody earning 2,500 shillings. That is your transport. That is your house allowance. That is your food. You pay for food. You pay for water, for all those things. Honorable Speaker, I think the committee, health committee, should visit
as many as possible hospitals so that they look at how are these people surviving with a mere 2,500 shillings per month, and they're not even getting that money. Honorable Speaker, the issue raised by Senator Wambua on the issue of patient-to-bed ratio, that is also something very important, and it needs discussion. This House needs to discuss how do we have 2 or 3 patients on a single bed. Honorable Speaker, if you go to some hospitals, people are sleeping on the floor. And we are saying we want to go to Singapore. How do you go to Singapore if you cannot even take care of your patients? You are community health providers. So you've seen, Honorable Speaker, complaints everywhere, most of the hospitals. So finally, Honorable Speaker, the issue raised by Senator Wambua touches on infection prevention. That is very important. If you prevent, the cost of treatment will be cheaper. But if you don't prevent, you end up paying a lot of cost. Finally, Honorable Speaker, the issue of cancer, screening, early detection is the most important thing. Do we have those things in the hospitals? In our hospitals, no. So what we need to...
Honorable Senators, we shall resume with the order paper, and I shall rearrange the order paper to go to order number 4. Clerk.
Order number 4, petitions.
Senator Veronica.
Thank you, Honorable Speaker. Honorable Speaker, this is a petition to the Senate on the illegal freezing of salaries and the exclusion of 313 seconded early childhood development education ECDE program officers from statutory pension rights under Cap 189. Mr. Speaker, sir, I take this opportunity to present this petition on behalf of Peter Makarangure, Alice Mudhoninganga, Winfred Waboi K. Karaja, Edith Wairimo Gatimu Kariambori, Agnes Joki Kuria, and other petitioners regarding the illegal freezing of salaries and exclusion of 313 seconded early childhood development education ECDE program officers from statutory pension rights under Cap 189. We, the undersigned citizens of Kenya and seconded ECDE program officers active and retired from the Teacher Service Commission to various county governments, draw the attention of the Senate to the following: that following the devolution of pre-primary education, 313 ECDE program officers were released by the Teacher Service Commission to county governments with effect from 1st July 2015 as permanent and pensionable officers. That upon the transfer of these officers, the National Treasury and the Integrated Personnel and Payroll Database IPPD Department recategorized their payroll status from pay group AA, being the national non-contributory pension category, to pay group AB, being a local contributory category. 3, that this recategorization was irregular and has had the effect of subjecting the officers to unlawful contributory pension deductions, including deductions to provident fund arrangements such as lab trust in some counties, despite the officers being entitled to non-contributory pension terms under Pension Act Cap 189. That the placement of the officers under pay group AB created a technical barrier that disconnected them from salary reviews applicable to their cadre under the Teacher Service Commission, the Public Service Commission, and the County Public Service Salaries Adjustment and Collective Bargaining Agreement benefits. That, as a result, the affected officers' salaries have effectively remained frozen at 2015 levels, causing them to miss salary increments under the 2017 to 2021 collective bargaining agreements, subsequent salary reviews in 2023, and the 2025 to 2029 increments. Honorable Speaker, that the salary stagnation has in turn depressed the officers' pensionable earnings, thereby exposing both serving and retired officers to reduced pension benefits that do not reflect their lawful entitlement or their years of service. That recognizing this grave error and the irreparable prejudice likely to be suffered by the officers, the National Treasury issued a directive dated 22nd March 2022, reference TNT/PENS/15/4/20, expressly requiring that the officers be restored to their rightful status under the Pension Act, Cap 189. That despite the said directive, the Teacher Service Commission and the IPPD Department have failed to effect the required recategorization, thereby leaving the officers in prolonged administrative limbo for over a decade. That the affected officers now face double exclusion in that they are denied TSC-related salary progression because of the AB coding, while at the same time they are not fully integrated into county or public service payroll structures because they remain substantively officers of the Teacher Service Commission. That retired officers in this category are already suffering prejudice because their pension awards are being computed on outdated and frozen salary scales instead of reconciled salary levels, resulting in unfairly low pension payments. That the officers who have retired and those due for retirement stand to suffer irreparable financial loss unless urgent corrective measures are taken, including restoration of the proper payroll category and reconciliation of their service records, including GP69 cards where applicable. Wherefore, your petitioners pray that the Senate investigates the matter with a view to 1, recommending that the directive of the National Treasury is implemented and that all historical data migrated from the legacy system is corrected to reflect a non-contributory status and to simultaneously update the officer's manual GP69 service records to reflect continuous service with zero service gaps from 1st July 2015 to date. 2, recommending that a comprehensive salary audit and reconciliation for the 313 officers, effective 1st July 2015, be done to include all annual increments and collective bargaining agreements, CBA salary awards 2017 to 2021, 2021 to 2025, and 2025 to 2029 that were missed during the period of suspended status. 3, recommending that the National Treasury releases arrears arising from the corrected salary scales and allowances, house, medical, and leave allowance to all active and retired petitioners. 4, recommending that the revision of pension awards for retired officers in this category be done using their newly reconciled final basic salary as the base for calculating their monthly pension and lump sum gratuity under Cap 189. 5, recommending that any contributory provident fund amounts, LAPTRA/CPF, deducted in error from the petitioner's salaries be stopped and refunded with interest without affecting the officer's non-contributory rights under the Pension Act. And 6, recommending that the 313 seconded ECDE program officers be recognized as having served continuously and without interruption under the Teacher Service Commission from the date of their first appointment, and that any exit or non-claim clause in the 2017 to 2021 or subsequent CBAs shall not apply to them, since their transfer to county governments was an authorized secondment in the public interest and not a voluntary or professional exit from the teaching service. That is the petition from the petitioners, and I beg Senate to consider this an award as requested by the petitioners.
Honorable Senators, pursuant to Standing Order 238-1, I commit the petition to the Standing